Good morning, good afternoon, good evening, and welcome to this podcast from the Global Leadership Exchange in Mental Health. My name is Peter Molyneux, he, him, and I'm the England lead for the Global Leadership Exchange. And this is one in a series of podcasts we're doing on the theme of ideas into action, which is the theme of the Global Leadership Exchange being held in Ottawa next June. Today, I'm delighted to say that we have with us Andy Bell, the Chief Executive of the Centre for Mental Health. And we're going to be having a conversation about what we see some of the issues being at the moment, what we see coming towards us over the horizon, and what some of the leadership challenges are at the moment. Andy, welcome.
Thank you
Perhaps
very
you'd just
much.
like to introduce yourself to people?
Hi, my name's Andy Bell. I work at Centre for Mental Health. We're a UK-based non-government organisation with an absolute passion for tackling inequalities in mental health and for creating a mentally healthier society for everyone to enjoy. I've been at the centre for a little bit more than 20 years and in this particular job since 2023. So I'm still learning this bit.
So what are the kind of things you're working on at the moment?
So we're a busy research organization. We've been looking at a whole range of issues from the social and economic determinants of our mental health, particularly focusing on some of the key areas around poverty and financial inequality and around racism and racial injustice, because we know how important they are. We also have done a lot of work recently looking at mental health services and how they can better meet people's needs.
Mm,
And that includes a whole range of things from ensuring that people living with mental illness have their voting rights respected and upheld, through to support for people's physical health and well-being, and indeed having better mental health services when you need them most, particularly when you're very unwell, including crisis care. So we do a lot of work in all those different areas of the system. And then very recently, we've produced a new strategy for the organisation looking ahead to the next 5 years. And we recently shared that with our friends in the wider world.
okay. We'll come on to the strategy in a moment, but I mean that's quite an impressive list. Is there anything you'd want to draw out of that list in terms of what you've done that you're particularly pleased about, or which you think has been particularly important?
It's hard to pick favorites, isn't it?
Sure.
I mean, I think, all the work we're doing is aiming to do one thing, which is bring about mental health equality.
Mm,
And that's particularly in the United Kingdom, but of course, we hope that our work is applicable and useful everywhere else around the world. We've had some really interesting conversations recently with international partners and partners here in the UK about bringing in a mental health in all policies approach. And we think this is incredibly important because we know that if we put mental health at the heart of government, whether that's local, national, regional, within different countries, that we could have much better policies that do a lot more for people's mental health and well-being, both at the prevention end, but also in terms of the lives of people with mental health difficulties. So we've been really excited about some of the developments around that kind of mental health in all policies approach, albeit we're yet to see that being really systemically adopted. So that's a really interesting challenge for us.
yeah. And I was really struck when you were talking about the work you're doing, how many of those issues that you're working on would also be the things we would say are incredibly important to someone's recovery. So actually a human rights approach, being empowered, having your voice amplified, making sure you're focusing on inequality and equity are all really important in terms of delivering recovery and are really important parts of what an all policies approach might need to be.
Well, that's right. We're often asked as mental health advocates to choose between, do we care more about prevention and public mental health, or do we care more about treatment services and people with mental illness?
Mm,
The reality is people's lives aren't divided like that.
mm,
Things that can promote good public mental health will be really good for people living with mental illness, and things that are good for people living with mental illness are undoubtedly good for the general public. So I think it's about understanding that there isn't that great divide. Actually, we're trying to achieve many of the same things, and if we bring them together, we actually achieve more. for people and communities than if we're kind of forced choosing in resource poor systems, whether we think we somehow prefer prevention or treatment.
Yeah. So when you talk about wanting to see mental health in all policies, what are the, I mean, one can see that in conceptual terms, that makes perfect sense. Why wouldn't you
Mm.
want to do that? What are the kind of challenges in terms of getting that implemented or getting that over the line?
I mean, I think it's really interesting, and I think, put simply, mental health isn't seen as being politically important enough and imperative to drive decision making in even in other bits of health policy. So even within the health system, mental health is often a bit of an afterthought after physical health. But when you look at policies relating to education, you look at policies relating to social security and the labour market, you look at justice system policies, we can see as mental health advocates that if you get things right for mental health and you think about people's mental health, you're going to get better results. Kids are going to do better in school,
Yeah.
workplaces are going to be more efficient and effective. Prisons aren't going to be as full of people who are struggling with their mental health. But policymakers don't see the connection or don't see the connection compellingly enough to act. And I think that's a huge challenge for us that we've really got to raise mental health up the agenda
Yeah.
rather than feeling like we're always having to make the argument for why it's important.
Yeah, it's interesting, isn't it? When you think how many of us as constituents are likely to have issues with our mental health and well-being in the course of our lives,
Mm.
there's a real task to get politicians and policymakers to understand how important mental health is.
Yeah, there's a big disconnect. There's a big disconnect. There certainly is in the UK, and I think from international partners, they feel the same thing. While many people will empathise now with particularly people with mental health difficulties, particularly common mental health difficulties, and there's certainly more conversation, more understanding, more awareness. That hasn't yet translated into it being a political imperative in
No.
quite the way that we think it could be and should be.
So when we look to the horizon, do you think there are particular challenges that are coming towards us that we need to get ready for?
Yeah, I think there are many challenges. I mean, certainly when we look at the situation in England and the UK, we see that there are rising numbers of people living with mental health difficulties. The population's mental health has got worse over the last decade. Now, that's not necessarily the case internationally, but it's certainly the case here.
Mhm.
So we're seeing more people suffering with mental health difficulties and having poor mental health. Um, and at the same time, we're seeing a real squeeze on services, and that means that there are long waits for help. Often people are told that they're not unwell enough yet to receive a service. And this can become very self-reinforcing. So I think we're really concerned about what the levels of need are and the fact that with mental health getting worse, it's almost generating less helpful responses. So we're seeing more of a pushback, and certainly many politicians and media commentators are now beginning to question, well, maybe that rise in mental ill health is not real, because the easiest thing you do if you don't have resources to deal with the problem is deny the problem.
Yeah.
And so I think this culture of denial, of the kind of raising awareness and literacy about mental health is a really big cultural and political challenge. As advocates, we really have to rise to that and be ready to deal with it. I think we also inevitably, because we understand the structural nature of our mental health, um, we have to look at some of the challenges that are kind of rising around the world. So increasing levels of conflict, displacement of people, changes in the climate, we know have a direct impact on people's mental health and well-being. So there's a lot going on that is sending us in a really, really unhelpful direction, and could make it both more likely more people will experience mental health difficulties, but also make it harder to respond helpfully. And so I think being able to really kind of change the nature of the conversation about mental health, just a little thing, but move it away from this notion that our mental health is an individual responsibility. Of course, we have some agency over our mental health. Of course, there are things we can do to be more resilient, as is often said.
Mhm.
And of course, it's important we all feel empowered to live mentally healthier lives as best we can.
Mhm.
But if we make it all about individuals, we'll inevitably end up seeing people being blamed
Yeah,
for the difficulties they're experiencing in their lives. And the real solutions, the solutions that would make a real difference, can just be ignored and missed. And we will miss an important opportunity to do the things that we believe have the best chance of working.
yeah. It's funny, isn't it? Because there's a lot of focus at the moment on individual resilience, but we need to make sure the focus is also on, well, what actually is doing the damage in the first place.
That's right.
So
That's right.
the schools we spend time in, the workplace, those of us that are fortunate to be in a workplace, the workplaces we're in, the environments we're in, we need to tackle those as well.
Yeah. Fundamental. I mean, obviously, people will often say, "Well, your mental health is about your brain chemistry," and sort of it is. But of
Mhm.
course, what causes that? There's nothing innate or inherent in us. If you look at the inequalities
Mm.
in people's mental health and well-being across populations, it comes down to inequity. It comes down to injustice. It comes down to people being treated less well because of whatever characteristics they happen to have. And so it's really important that if we were to think, what would create mentally healthier neighborhoods for people to live in,
Mm.
mentally healthier schools, mentally healthier workplaces, all these things, online communities as well. Um, if we think about how we can create the conditions for people to have good mental health,
Mm.
then at the very least, we can give people a much better chance, including of recovering. People can live good, contributing lives with mental illness. Um, that's one of the things that we've learned through our work supporting employment services using individual placement and support. Um, and so it's really important. We think that everyone has a right to well-being, including those who are struggling now with their mental health.
Yeah. So obviously you've given this a lot of thought, both you as a leader and the Centre for Mental Health as an organization. So what are you planning to focus on in terms of the next 5 years?
So we're going to continue to focus on, if you like, the kind of social determinants of mental health. So what we can do to create the right environments for people to live in and work in and learn in. We want to make sure we do that across all age groups. So we have a significant focus in our work on children and young people's mental health.
Mhm.
But we also remember there's an aging population and people in later life deserve to have good mental health as well.
Mm.
And so we need to think about how we can create the conditions for that as the population gets older. We want to continue focusing on supporting people through work and to get the jobs they want when they want them. So we'll continue our work to train up more people in individual placement and support. That's really important. But I think increasingly what we want to do through our research and our learning and our knowledge building is very much to bring together different forms of knowledge. Traditionally, research organizations have come with this pretense of objectivity, a rather westernized approach to learning, if you like, that somehow researchers are separate from the world and can come and find an objective truth.
Mm.
And I think, we among others have undoubtedly done that.
Mhm.
And we want to shift the way we learn and the shift the way we build knowledge so that we're really doing that alongside people and communities, and particularly bringing experiential knowledge
Yeah.
into the mental health system much more regularly and effectively. So we know that we want to change things. We want to be part of the movement towards anti-racism.
Mhm.
And that means adopting anti-racist and anti-oppressive tactics in the way we do that. Um, so yeah, we've got a lot to learn too. We want to continue learning over the next period of time. It's very important to us that we don't think we hold all the answers.
Yeah. I mean, you've started to talk about this a bit already, but what would you like to see other people doing?
Um, I mean, I think what I'm really encouraged by and what I think more and more people are doing is that we are now talking more about mental health as a structural issue. I see it more and more wherever I go is that there is that growing understanding that you can't just talk people into having good mental health. Um, I love all the campaigns that have said just talk, reach out, help your mates. They're brilliant. Um, but I think we need to also understand the bigger structural factors, and I think more and more people are embracing that and realizing that we have to focus on inequity and injustice in order for everyone to have better mental health. Traditional approaches to public health across the piece have tended to favor better off people. Because they've tended to focus on lifestyle interventions. It's easier to do if you're doing well for yourself and got agency over your life in more of a way. So I think it's really exciting that more people are having those debates and discussions about the structural factors.
Mm.
Um, but we need to keep doing that.
Yeah.
We don't have to, this is going to take a lot of work. To really shift the focus away from that relentless individualism that we've faced for a very long time.
So does that, I mean, if we're really serious about seeing people as experts in their own care, seeing communities as experts in what's going to work in their particular context or their particular environment, that presumably changes what leadership is, or it certainly means that we have to think about a different skill set when we think about leadership. What do you think being a good leader looks like in if this is going to work?
I mean, the people I look at and think, wow, they're amazing.
Mm.
The people who, I mean, first start, leadership doesn't necessarily come with a job title.
No.
Leadership comes from people who are prepared to give it, prepared to
Mm-hmm.
be leaders, whatever happens to say on their business card. Um, and I think the thing that I always am bowled over by is first of all, people who are prepared to challenge how things are. Um, and really kind of ask those difficult questions of the rest of the system and society and be prepared to stick the neck out. Um, but also those who are really prepared to listen and really prepared to understand and admit they're wrong. Sometimes you have to change course. And I think it's really impressive when leaders, particularly people in powerful positions, are able to actually accept that we do need to do things differently. We have got this wrong in the past, or we've acted in ways which have been unhelpful. Um, so yeah, I never cease to be amazed by the ability of folk working in the mental health sector and the sectors around it to really affect change and be really courageous in the way that they're prepared to speak out, call out things that need to be called out, and just keep rolling that stone up the hill because it's hard and we get
Mm.
pushed back a lot.
Mm.
Um, so yeah, I think it's one of the great joys of working in this world is the people I get to work alongside.
And what would your advice be to someone who was starting out on that journey?
Gosh, the thing is, it's a really individual journey, isn't it? Because in a sense, we each of us have a very different experience of it, and it comes from the time at which, we happen. You don't choose the times you live in, so you have to deal with the ones you got. Um, so I think it's really difficult. I mean, the one thing I think that really does matter is having people around you trust, um, and people who can help you out, who you can help out. Building connections with
Yeah.
other people who can maybe give you difficult feedback when you need it, or have a discussion with about why something doesn't appear to be working, or how frustrating things are. So I think that sense of having a really diverse range of people around you, um, I do think it makes a really big difference because none of us on our own can hold all the knowledge or have all the different ways of doing things. There are things that I'm quite good at and things that I'm not good at, but I have colleagues who are good at the things I'm not. Um, and I think having that sense of being connected to others who are different to you and can bring something different to you, really makes a difference. It hopefully gets away from that idea that leadership is all about being all things to all people and being indispensable.
Yeah. So so 5 years is both a long time and and not a very long time. It kind of both things are true, aren't they?
Yeah.
But if we were sitting here in 5 years' time, what's the thing you would hope that we could see then that we can't yet see today?
I would love it if in 5 years' time we could say that mental health was really starting to significantly influence the ways in which governments at all levels are working. Um, and that can be in different countries, it can be in localities, it can be at community level, it doesn't matter where it is. But actually, we can begin to see that the public's mental health and the lives of people with mental illness are a really serious consideration. It doesn't mean that everything will be perfect in 5 years. It quite clearly won't. And we've got some huge challenges over the next 5 years,
Mm,
given the kind of political situations that we're seeing in many, many countries right now,
mm,
which in many ways threaten to push us back rather than forward.
mhm.
Um, so I think if we can begin to see some movement, we can see that actually mental health policy is about much more than mental health services. But at the same
Yeah,
time, mental health services are getting the support they need and being taken seriously.
yeah.
So I think if we can begin to see some movement there,
Mm,
and I also hope that we're able to unearth new insights and ways of working that can use the resources we've got better. Um, and again, we begin to see a shift away from so much of the kind of coercive and punitive approaches to mental distress that still predominate in many parts of the world. Again, we won't eradicate that in 5 years, but if we can move the stone a bit up the hill, that will still be important.
Andy Bell, thank you very much.
Thank you.